Hey everybody, good afternoon. This is Dr. Sullivan back with you for part 2 of our lecture series on brain plasticity after a stroke. So many of you were kind enough to reach out to me during the hurricane knowing that I am in North Carolina and asking me how I was doing, and I fared pretty good. We did have no power, no water for 4 days at my house, which was definitely tough, but when you see the devastation that's happened more statewide, it definitely puts that in perspective. But I am very, very grateful to be back here at work, very grateful to be sitting in front of you tonight. I wasn't sure if the hurricane would keep us apart for another week, but here we are. So that is something to be grateful for. This is I Care for Your Brain, and I have been doing weekly lectures here on Facebook for almost a year. We started this, hey Jill, we started this in October, and really why I do this is to fill a very critical gap in brain health care, and I think the gap is really focused on two things. The first one is science-based education and empowerment, and the second one is support. There are so many people that come to see me that are simply lacking in information. And when they finally hear about what a neuropsychologist does, they're very excited because we are the professionals that are experts in brain and behavior and how things like stroke affect the whole person, not just looking at the brain as just yet another part of the body. Of course, it is the organ of self and of spirit and of mind. And if we don't take into account all those other aspects, we're going to be missing a huge opportunity to optimize recovery and to connect with people who are suffering and reduce their pain. So I thought that what I could do as part of a solution to this problem is simply share the knowledge that I have been lucky enough to learn throughout my education with all of you here on Facebook. It is a free platform, which is fantastic, and I've been able to reach people from all over the world. I have buddies in Australia now, my friend Miss Sue. I have people who are in Asia. We have folks coming from South Africa, and of course the United States, and it just feels very rewarding for me to be able to have that kind of reach. So thank you for being here with me. So we met 2 weeks ago to talk about brain plasticity after stroke, and what I told you is that I've been in the midst of writing a interactive stroke recovery guide for a few months now. This was an idea that came to me while I was on vacation, and I was looking at some stroke support Facebook groups, and I just really got exasperated, and I couldn't take the lack of knowledge that was out there about neuroplasticity. And there's so many basic principles that if you just understand them, you can apply it to your whole life, whether or not you have really good insurance, whether or not you have access to brain health experts, or if you have the best insurance. If you just understand 10 principles of brain functioning, you can really apply it across the board. So this was an idea that came to me, and I thought, I'm gonna make it a 3-page PDF and we'll get it out to all the stroke support groups. Well, over time, it's about 123 pages now, and it's really comprehensive, and what I love about it is that it's gonna be interactive. Now, because I want it to be so good, of course, it's taking us a little bit longer than we anticipated, and the hurricane kind of set us back a couple days, but we are definitely on it, and that should be coming to you guys in about a month. So we focus on stroke because it is the most prevalent neurological condition, and there's a lot of misinformation. So what we talked about last time is the stereotype that recovery only happens within a brief amount of time. So the first thought on this, going back 20, 25 years, was that there was no recovery of function, that after a stroke, brain cells that were damaged were dead, and that was it. Then they got generous and they expanded it to be about a year, and it was kind of like this window idea, and if you didn't meet whatever recovery you met within that year, that was going to be your optimal outcome. Then they got a little bit more generous and it became 2 to 3 years. But the truth that brain scientists know is that your recovery is never ending, and the amount that you put into your recovery is going to be what you get back. So the first thing that we need to do, of course, is to recognize what has the impact of the stroke been. And one of the things that really bugs me as a neuropsychologist emphasis on psychologists, is that we have a disproportionate focus on physical and sensory symptoms after stroke. And one of the things I try to have you do in this lecture series is to really be aware of all the impacts on your person, on your social self, on your finances, on your intimate life. There's all sorts of ways that the stroke kind of reaches out and impacts your life, but we don't talk enough about some of those more, under the surface kind of symptoms. So that's part of why I'm here with you too. So last time we talked about the fact that there are 3 types of recovery following stroke, and we often talk about the first 2. So the first one, of course, is repair at the biological level. This is new brain cells or parts of brain cells sprouting, getting in there, regrowing, and returning function, okay? The second one is learning to compensate, kind of working around. So you can't tie your shoes with both hands like you used to. Can you find a way to do it with your good left hand? The third one, and this is the one that doesn't get enough press time, is acceptance of changes. This is changing our expectations, redefining what success means, learning to lean into some of the limitations as opposed to bucking up against them all the time. And we're actually going to talk about that a lot more tonight. So what I did 2 weeks ago was my first top 5 rules of rehab. And what we're going to do tonight is numbers 6 through 10. So the first thing that I talked to you about last time, the first rule of rehab is that everything has to start with a good quality assessment. So the first thing you have to do is reflect on all those stroke symptoms. So remember, I said it's not just physical, it's not just what happened to your body, it's not just what happened to your vision, it's what happened to your person, your ability to connect with people, your finances, your ability to work, to drive, to be physically connected to other people. There's all these different ways that stroke impacts us, and your job is to reflect on your own or with someone that you trust, what exactly are these changes? Then your job is to go to a medical professional and communicate these concerns. And their job is to help you get connected with the very best medical provider that you can to have an assessment. So by an assessment, I mean like an intake, a detailed test that tells you this is where you are today, helps you identify what your future goal is, and gives you the step-by-steps to get there. So I often think of it like a map. And if you don't have the map, how the heck do you know how to get out of the forest? You need to know exactly where you are now, exactly where you're going in the future, and ideally some companionship to get you there along the way. Number 2, our second rule of rehab is build on what is familiar and emotional. We talked last time about how the brain is organized in brain networks, and they are long-standing and related to our life experiences. And the more emotional, the more personal our life experiences have been, the more deeply rooted these brain networks are. And brain networks, what's so cool about them and why you need to know in your recovery is that they are what we call widely distributed. And a stroke is a focal injury. And so oftentimes there are still fragments and bits and pieces of the network that are there, and we're trying to rebuild around the focal injury of the stroke. So what you want to do is bring in anything that is personal and meaningful to that person into their rehab. So once you understand that, you can bring therapeutic value to almost everything. So we want to make sure that we're involving all the senses, the music people have always liked, the smells, even motivating people with food is actually completely fine. Bringing in the sports jersey that they like, putting up a poster on the wall, and that's kind of the goal, to get them to walk. Anything that you can do that is meaningful to the person and their life history, because you will be accessing part of that network, and we're going to have more fuel going into that therapeutic activity. Number 3, the third rule of rehab is repetition and consistency. Your brain is going to master whatever it does repeatedly. So it's either going to master sitting on the couch, or it's going to master doing your speech exercises. So you do have control there of what it is you choose to spend your time doing. So research supports about 2 hours a day in stroke recovery of intense rehab, except if you're doing something called Constraint Induced therapy. This is if you have paralysis in your one side of your arm or your hand, and they actually put the good hand, into like a sling, and they force people to use their impaired hand about 90% of their waking hours. And that's one therapy approach that actually needs to be more intensive. Number 4 is harnessing the power of your mind, remembering that a stroke happened to your brain, not to your mind, not to your spirit, okay? This is where there's power in things like mirror box therapy, mental imagery. One thing that I talked about last time is that research suggests that even when we imagine ourselves doing an action, a movement, the same neural networks are actually stimulated as if we were doing the actual task. So how cool is that, and how important is that you guys understand that? Because if you have a hard time, you have paralysis in your right hand and you physically can't do this, if you can imagine it in your mind, research tells us that that is just as good as being able to actually move it, and that is therapy. So the power of visualization cannot be overstated. The last one I shared with you last time, rule number 5, is the importance of prioritizing uninterrupted sleep. And many people after a stroke, about 50%, have trouble with sleep. They either sleep too much or they sleep too little. What is key is that for optimal recovery, people are allowed naturally to go in and out of the 5 phases of sleep. Stages 4 and 5 are your deep sleep stages, and this is where our immune system really kicks in and can gobble up all of the things that unfortunately are left over after a stroke. Things like blood, things like the contents of brain cells. After a stroke, there's a big cleanup job to be done, and it is the immune system. We have 2, we have one in our body and one in our brain, that really can kick in deep sleep. If anything pulls you out of sleep, sleep apnea, nightmares, insomnia, cramping, spasticity, you're never ever going to be able to really go in and out of those 5 cycles, and that's really, really critical. The other thing that our brain miraculously does in deep sleep is it plays tapes of what we did all day long to try to deduce meaning and to really pull the most important information out of our life experience. So look at it like free therapy. Your brain, if you are, let's say, doing physical therapy and you are trying to work on your balance, when you are in deep sleep, your brain is going to be replaying those balance exercises over and over and over again. So if we know we're supposed to get 2 hours of intensive therapy every day, maybe for some reason you can only get 1 hour during the day, either access to a professional, or your motivation is all screwed up because of the stroke, or you're too tired. In deep sleep, you're actually getting more of that time, more minutes under your belt where you're reviewing and doing repetitive activities. It's also tremendous for processing emotionally traumatic events, and we have to make sure that we're always talking about that again when we talk about stroke, because we never want to minimize it as just a medical problem. That's something that is so painful to me that I see way, way, way too often, is people's emotional trauma with the stroke is not recognized. So now what we're going to do after that review, let's go over to my final 4 rules. So this is number 6, 7, 8, 9, and 10. And get into those in more depth. That was just kind of a brief reminder of what we did last time. So number 6, this is increase your emotional resilience. Now, what does that actually mean? This is our ability to adapt to stressful situations or crises. And what is so awesome about emotional resilience is you can increase it at any time. Now, not 100%, but there's a big enough portion of it that you have control over that it made it into my top 10. There are aspects of emotional resilience that are unfortunately not under your control. Things like how emotionally reactive we are to stress, to some degree, is hardwired, and it just has to do with our genetics and kind of people's sensitivity to stress. The support that we have around us, sometimes that's not under control. We, might be in a different part of the world than our friends and family are. Unfortunately, we know people with all sorts of brain issues aren't exactly embraced socially by many people. Oftentimes there's a social isolation that is very tragic that happens. Your language or articulation abilities, if you have aphasia following a stroke, of course, these all, the degree of your disability, these all are going to impact your emotional resilience. However, the most important element of emotional resilience is your attitude, and this is something that a lot of you have more control over than you might realize. In stroke recovery, a positive and motivated attitude has been associated with better recovery in all aspects, physical, psychological. It's pretty amazing. So what are some ways that you can improve it? First one is recognize that we're not talking about not being realistic, right? You have to be based in reality. But what I don't want people to do is get into black or white thinking, or what we call catastrophic thinking. And how are you going to know if this is happening? When you start to speak in absolutes, this always happens, this never happens, that needs to be a little alarm bell that goes off in your brain that says, whoa, 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 I think I'm getting a little distorted here. Most of the world is gray. Okay, very few things are over here in white territory. Over here, very few things are extremely black. So very little is concrete. There's a whole world that exists in between those two. What can happen after any trauma, though, is it feels somehow safer to start thinking like this, right? So you're either healthy or you're not healthy. People can either be trusted or they can't. Doctors are all terrible, or they can be trusted. So once you start to get extreme, that's a sign to you, okay, I'm actually not being very resilient here. You have to really be based in reality. And there is something called post-traumatic growth. It's very important at some point in your recovery to take a step back and to realize, is there any way, even a small way, that I am better, I am stronger now because I had this stroke than I would be previously? Okay, one of the ways that you can do this is by simply increasing your emotional awareness to respect the feelings that you have, and to then be able to label them and say, I thought I was just mad, but it turns out, I'm jealous when I see other people carefree riding a bicycle down the street. I'm jealous when I see somebody walk without a cane. I'm envious that I wasn't able to be living that life right now. And that is more emotionally strong because you're living in your truth. The second thing is to increase your gratitude. And this was a big thing Oprah taught us 10 years ago. Do you guys all remember that, when she had her gratitude journal? But it turns out this actually has scientific backing. So what the research tells us is that if you write down 3 things every day that you are grateful for, that this significantly improves our attitude, our ability to be more grateful in the future. So it's kind of like the more you pay attention to something, the more likely you are to see it in the world. So one thing you can do as a result of our time together tonight is to start to do this. And these are the prompts that I would encourage you to do, say like in a journal. Today, I appreciate the opportunity to, you fill in the blank. Today, I am grateful for, fill in the blank. Today, I thanked this person for helping me in my recovery. So just being more observant and giving more feedback in the world about the things that are going well for you that you can appreciate. This brings us to number 7. This is supporting those who support you. You have to remember, a stroke did not just happen to you. It also happens to the people that love and care about you. So as you move through your recovery, I think it's really healthy and important to really try your best to recognize the people that have made a positive impact in your recovery. And I can be guilty of this too. It's very easy to point out the people that don't do a great job and don't show up for us. But the truth is, there's also plenty of people in little and small ways that have made the recovery a little bit easier, a little bit more supported than it would have been before. And that's just very important to make sure that you don't become an island, right? And you're not, because everybody needs validation and feedback. So it's very important to recognize if there's someone who's really been a caregiver to you and has supported you along the way. Number 8 is to acknowledge your trauma. We used to just talk about post-traumatic stress as it related to combat, and then people who had been assaulted were included. But now we know, as of about 15 years ago, that internal traumas that are life-threatening, sudden, threaten our well-being, like a stroke, also can cause the spectrum of post-traumatic stress. And on one extreme, you have full-blown PTSD, post-traumatic stress disorder. But guess what? You can also have just a little flavor of it. And why it's important that you know is because this can interfere with your recovery. You might not want to do the therapy as much as you should. You can become very socially isolated. You can become emotionally numb. And you can stay in a state that is so uncomfortable to just be in your own skin that you can really start to develop things like depression and anxiety. So I want to talk to you about the 4 main clusters that happen to people when they're in the PTSD spectrum. So what's important to know is that you may have bits and pieces of this, but when it really gets concerning is when these issues are persistent, meaning they last more than about a month, 2 months. They really interfere with your quality of life. They interfere with your social functioning, your ability to engage in your rehab. So the first one is what we call re-experiencing. And this is reliving the stroke over and over and over and over again in your mind, almost where it feels kind of intrusive, like you can't not think about it. The second one is avoidance, avoiding anything that reminds you of the stroke because it freaks you out and you get a lot of anxiety. Avoiding the smell of hospitals. If you see an ambulance, if you happen to go in one, you just want to block that out. Basically not wanting to talk about it, not wanting to think about it, kind of wishing you could just pretend that it didn't happen. Number 3 is emotional numbness, feeling cut off from people, a reluctance to talk about it, and feeling like, I know intellectually that I care about these people, but I can't emotionally feel it anymore. And number 4 is hyperarousal, feeling like you're constantly, I think a lot of people have this, feeling like you're constantly on alert for the signs of another stroke. And for many people, there's this illusion that there were warning signs and I didn't notice. And that's what we do in the face of trauma, is we coulda, woulda, shoulda ourselves. And we think, oh my gosh, if I only would have paid attention to that little twinge I had in my left eye, or, I knew I had a headache and I wish I would have just gone to the hospital. But the truth is that we can't control those things. And if you didn't wind up having a stroke, you would have never thought about those things again. And they've probably happened to you hundreds, if not thousands of times in your life. It's just after a trauma, it's safer to think that we could have actually controlled it or stopped it when really we couldn't. So one of the first steps that's important, if this is resonating with you, is to acknowledge that a psychologically traumatic event has happened to you. There's usually 5 areas of life that have been impacted, and this is really inspired by a woman named Dr. Patricia Resick that I had the good fortune of working with at the Boston VA when I was finishing my training up there, and she's done really important work in her development of something called cognitive processing therapy. So I've kind of adapted this from her thinking. And so these 5 areas are, and this is thinking through how the stroke has impacted you, your sense of safety in the world, your sense of your own safety in your own body. Number 2 is trust, feeling like I can trust what I feel in my body, feeling that I can trust the concern of other people. Number 2 is power, feeling like I am capable, I can meet the challenges of life. Number 4 is esteem, so your confidence, feeling like you are capable, that you can manage. And the final one is intimacy, your ability to feel close to yourself and to other people. So I think that those 5 areas are worthy of some reflection on your part after this lecture, to really think through how have you been affected by those things. In the stroke guide, one of the areas I am most proudest of is that we have some writing prompts and some journaling to really get people thinking about these things, because isn't it different from the way that you're used to thinking? I mean, even when we read articles about stroke, so often it's about physical recovery, motor function, and post-stroke depression, anxiety, it definitely gets its time. But man, there's just this whole other world about trauma and adaptation and acceptance that I just don't think that we talk about nearly enough. The last thing I wanted to say in this section was it's so important after a stroke to emphasize security and safety in someone's life, because that's really what a trauma rocks, right? We are all walking around with kind of an illusion of safety before something traumatic happens. And once something unexpected and really, really scary happens, everything seems really scary and everything feels like it could be really unpredictable. So very, very helpful to make life as routine and predictable as you can. Even if it almost feels a little controlling at first, you want to just have people be able to depend on what happens in their everyday. My 9th rule is insisting on follow-up care. Historically, care fragments when people leave acute care settings. So what I try to do is empower people to insist on treatment and a treatment plan, and you can only do that if you know what the gold standard is. So it's very important to me that people know what an ideal care team looks like, who are the different providers that should be on your team, how often should you see them, what is a reason you might want to insist on a follow-up appointment. But research tells us that things are changing a little bit, which is great, and it's important to have follow-up care as a standard for two main reasons. The first one is recurrence prevention. So research definitely indicates that in-person discussions with a medical provider at multiple points after a stroke that emphasizes prevention, so talking about why you had it and what you can specifically do to reduce the chances of having another stroke, are the most effective things at keeping people from having a second or a third stroke. The second reason is long-term recovery of function. If you're not meeting with your doctors, you're never going to get that updated prescription for speech therapy. You might not talk about the subtle attention problems that you have, the aphasia that you still have, and you might not get that referral to a neuropsychologist. So going and seeing a neurologist, your physiatrist, your rehab doctor, these are ways that you can get greater access to care beyond those doctors. And the last one, maybe the most important one, which is the transformational power of acceptance. One of the things I think unfortunately happens when we talk about stroke recovery is we get very rah-rah and we focus on total recovery or nothing at all. And we're not at all spending enough time talking about using your same determination, your same stubbornness in some cases, to also apply that to acceptance. And I think that we need to talk about taking that same tenacity and applying it to not resisting the symptoms, but finding a way to adapt and to live despite them. And I think that this is actually so important that when I was working on this before I came to you tonight, I decided that that's what I want to talk about for the whole half hour next week. I think we should just spend the whole time talking about adaptation and acceptance. So for many people, as you all know out there, this can be the hardest part. Many people do not return to the way that they were prior to their stroke. And we have lifelong changes in our sense of self, our concept of the world, our concept of safety. And we really need to spend some time talking about what do psychologists tell us, what do they have to teach us about how we can live our very best life despite some very unexpected and traumatic turns. So that's what we're going to talk about next time. I really feel so grateful to be able to be here with you tonight and share this information with you. When you guys make comments about how much it helped you, that really, really means a lot to me. And actually, it was one of our followers, Jennifer Lingard. I just wanted to say hi to her. She left me the most meaningful comment in the last lecture about acceptance and how the lecture had really helped her push through some hurdles that she had. So I'm going to dedicate my next lecture to you, Jennifer. But thank you guys for being here. I want this information to reach as many people as possible. So if you're in stroke support groups online, please share it. It's just so important that as many people have access to this information as possible. I thank you so much again, and I will see you guys next time. Take care. Bye-bye.